Our next speaker are Drs. Forster. Dr. Forster and his father are holistic medical practitioners. They're bringing you 3 generations of medical expertise. Together, they will address the biological factors contributing to behavioral challenges through overall wellness as it relates to healthy living. Thank you. The Forsters have seen hundreds of children improve through their unique approach to their health needs and challenges. We are delighted to call them up to share a few words. Thank you.
Hello. I'll put it in here. Yeah. Okay. You want to set that up for me a little higher? I appreciate it. Thank you. Thank you very much. Thank you for being here. Thank you for having my son and I help you have a greater understanding and give you a moment to learn something that is just so obvious to us, but not to the rest of the world, it seems, because the more patients we meet, the more we're amazed that they're first hearing about what we do. The reason why we're here tonight is we have a legacy. My father began treating the community in 1960. I joined the practice in 1985, and now my son, 3rd generation, is with us. And we're almost 65 years old, kind of unheard of, and our practice consists of well over 50, 60, maybe 70% of the practice is babies and children. And I think the other 30% that is adults, the only reason for that is all the babies I've taken care of grew up, and now they're taking their babies to me. So we're actually taking care of 5 generations right now in the community from all over. Thank you. I guess the harder you pray, the better you get. So I'd like to say that my son is going to bring us through a wonderful PowerPoint presentation, and I'm going to more ad-lib. I'm going to let him teach most of this course, and then I'll give you some of my experiences afterward with each slide. So please enjoy, and thank you very much for having us.
All right, so one of these things is that a lot of education is centered around how to prevent a child from maybe getting autism or other behavioral conditions. And there could be some truth to that, and there could be some triggers. However, in this room tonight, that's the aftermath. You guys already might have children who have behavioral conditions, and instead of just labeling them and accepting it for what is, there's actually so much you can actually do about it. So what I'm gonna take you through is nutritionally what you can do to help with your child, supplementation-wise, chiropractic care, as well as certain toxins and triggers in your environment that you may or may not be aware of. So enjoy. So the first thing is to understand what's going on in your child's brain. So if you look at that top slide on the top right, that's an ankle. So if you look at my ankle right now, you walk and then all of a sudden you rolled it. You rolled it bad, and then if you look at it, it's red, hot, and swollen. Red, bruising. Hot, if you put your hand on that ankle skin, it feels hot to touch, and it's a swollen ankle. So it's easy to notice that. And when you have a red hot swollen ankle that you rolled, what are you gonna do if you rolled that right ankle? You're gonna put more weight on your left foot until this right one heals. However, when it comes to a brain that's red hot and swollen, if you look at the top left, that's a brain scan of an inflamed brain. When you look at the center, that's an MRI angiogram, which measures arteries. That's an inflamed brain. However, unlike that swollen ankle, you can't see that from the outside. You can't see a swollen brain. So how it feels, the way you feel a swollen ankle, is like that burning building. That's what an inflamed brain looks like. So that brain and that ankle are the exact same thing. But instead of showing a swollen brain, the way the body shows an inflamed brain is with the bottom left, a child's mood or an adult mood. So if a child is acting very inappropriately, it's not because the child is upset, to a degree, but it's because the child's brain is inflamed. Now, I'm going to take you through why it's inflamed and how you can actually deflame it, the way you can take pressure off an ankle or do a hose against a fire home.
Good, beautifully stated. I just want to say that all the speakers tonight are presenting things that are very proactive for you and causal related, and that's what's so special about what I'm seeing this evening. This is a prime example of it, and two things real quick on inflammation from me. The first is a little real estate joke. What are the most three important reasons about real estate? Location, location, location. Well, inflammation is the same way in the body. Wherever it shows up, it's still inflammation. If it shows up in an ankle, you'll have trouble walking. If it shows up in the brain, you'll have trouble processing. So it's just where the inflammation shows up. The most interesting aspect of inflammation these days is that we learned it as red hot and swollen, any of the combination thereof, but there is something called subclinical or cellular inflammation. This is inflammation that your body is experiencing, your immune systems are dealing with it, and it's flying under the radar. You're unaware of it because there is no symptomatology. And most people run their health programs by how they feel, which is very dangerous. Things have to be objective. You have to be evaluated by professionals, things like blood tests, and let computers tell you what's going on and coordinate all the data. Next slide.
So, let's go through different ways the brain is inflamed and how we can do about it through, we'll start off with nutrition. So the first concept we're going to go through that many of you, because you're not doctors in this room, may or may not have heard of, is called methylation. So the question is, what's methylation? Methylation is that we have certain genetic traits that are vulnerable that aren't turning on. So the best example of it is if we have a light in this room and we have a switch, we can turn the light on or turn the light off. Now, what if a child, you flip the switch, but the light doesn't turn on in the brain? That's due to genetic mutations. So if you can see there, if it says under methylation on the top right, there's letters. And if someone has certain genetic SNPs, which are certain gene variants or mutations that can't turn a light on, that will give a lack of nutrients or nerves to the brain. What causes a switch to turn on? They're known as B vitamins. There's 12 of them, 12 B vitamins. If you look at this arrow to this cycle, the way energy is made is through B vitamins. So if you look at the top, it says vitamin B9. And for a normal person, when you flip the switch, it becomes active in the body. Active B9 becomes folate, the folate cycle. There's some children that are born with certain genetic mutations where the B9 doesn't get activated into the active B9 known as folate. Now here's the thing, in nature when you eat food, you always eat inactive B vitamins. And if your body doesn't have the genetics to activate it, well, that's going to lead to some behavioral and neurologic issues. So, what can we do about it? Before we go into what we can do about it, actually, if you can look in the bottom right, it shows that nutrition deficiencies come from cranial nerve damage. Cranial nerve. A lot of mothers come in and say, do you do cranial sacral therapy? Well, underneath the brain, if you look from underneath, those are all cranial nerves. What gives nutrients to cranial nerves that go to the brain? Active B vitamins. And if it's not activated, your cranial nerves are not working. So as you can see there, if you look at the last bullet, it's the active vitamin B9, folate. So the thing is if a child can't activate it, what can you do? Well, in our office, we actually methylate our children, our patients, and give them the active methyl B vitamins. So instead of succumbing to the fact that they can't activate their B vitamins, they can't turn the switch on because of their genetics, we give them a supplement already in the active form. And once you give in the active form and it turns on the cranial nerves that go to the brain, all of a sudden their brain turns on and they become aware and alert. So I think that's a good example.
It's great. The thing on methylation, don't let the chemistry word throw you. It's just based on something very simple called methyl groups, which is a carbon with 3 hydrogens, and as you move them around the body with these B vitamins, it's simply rearranging furniture molecularly in the body, and it would be the same in a room. If you change the furniture, the flow of traffic in the room would change, and that's what's happening with all the children that we're seeing. And when I say all the children, I mean, I'm in practice over 40 years. We have seen hundreds of thousands of children, not a few hundred. So we're talking from a lot of experience, and of course I grew up around it the way he did, so I watched this all happening in my father's office my whole life. So long before I arrived on the scene, my father was doing a lot of this work, and there was no name for it yet. He didn't know it was methylation. There was no thing as functional medicine, and kinesiology was just born, and he was part of the birth of that. So this work has been around for a while, but it just hasn't been brought to the public in a simplistic form where you could understand it and you know somebody that you can go to for the service. So.
Okay, let's go on to the next nutrition. So first we went through the B vitamins and how the B vitamins can go to the cranial nerves of the brain. Now, it's a good thing to understand what the brain is made of. The brain, if you look at the top right, 60% of your brain is made of fats. Now, a little before my time, there was this whole low-fat craze that if you eat fat, you become overweight. And they went through this whole carb situation, and everything is a low-fat yogurt. That is such a shame because it is the fuel of what makes our brain, to the point that the more fats you eat, the bigger your brain is when you develop. The less fat you give your child, the smaller the brain of the child. Now, one of the 2 fats, if you look to the top left, is called DHA. That's a type of fat, docosahexaenoic acid. DHA is how the brain develops as a child. The one that makes it deflame, you remember inflammation from the first slide, the way to deflame it is from the other fat called EPA, icosapentathenic acid. Who cares about the fancy name? DHA grows the brain, EPA deflames the brain. So in the office, this is actually my father would take the honors of creating this formula or influencing it. If you can see, it says children DHA EPA liquid for children. We squirt it 20 drops in the mouth every single day as they're developing, which helps grow their brain with DHA. And because their brain is made of 60% fat, it grows their fat. So you can't get mad at us when they end up getting A's in school, because their brain's going to be developing. Now, if you look all the way to the right, that's the adult form. And if you look at the ingredients, it's actually flipped. It's EPA, DHA. It flips as an adult because when we're adult, our brain is pretty much developed for the most part, even though there's always neuroplasticity. However, at the point you're an adult, it's more important to deflame the brain, because if it's inflamed for a long time, then you hear other scary things like dementia and, may I say, Alzheimer's. Now, it's not always about the supplementation. It's what can you eat? Well, you can eat fats. So, what are some fats? There's a great line by Dr. Stephen Gundry, and he says the only purpose of eating food is to get extra virgin olive oil into your mouth. It is the easiest way. Now, if you move on, all the wild-caught fish, sardines, anchovies, herring, wild-caught salmon, are all loaded with this fish. Actually, these liquids that we give in the office are made of sardines and anchovies. If you look to the bottom of it, nuts. Nuts have really healthy fats. And I don't think Mother Nature makes mistakes, that the walnut looks like a brain. And part of a walnut has a certain fat called alpha-linolenic acid, and that also creates a healthier, bigger, stronger brain. This is another great type of oil that's a little bit more on the newer side. It's not as known, but it should become known, and you guys could be the first. It's called medium chain triglyceride, MCT oil, specifically C8 caprylic oil, which also helps develop the brain, and the classic avocado. So I pretty much eat a full avocado every single day of my life. I eat sardines or some kind of wild-caught salmon about 3 or 4 times a week. I put olive oil on everything. I have a handful of walnuts, pistachios, pecan, hazelnuts of some sort, and I put some MCT oil in my coffee every single day of my life, because that's how I want my brain to look. And if you're not feeding your child healthy fats like this, how can you expect their brain to develop and grow appropriately? Give the brain what it needs. Give it methylated B vitamins and give it fats and see what happens to the brain.
Excellent. I think I gave him too many fats when he was a baby.
I'm a fathead, by the way.
Anyway, the one part of the slide I do want to cover is that one of the ways that we profile people, very much with a lot of lab testing, saliva, urine, and blood, and the blood testing can give us ratios, and the ratios are very insightful. And if you are deflamed and really living at optimal health standards, then your ratio is 2 to 1, 3 to 1, 4 to 1 in that region of disease prevention. And the Western diet, or typical, it's called SAD, Standard American Diet. That will bring you to a 15 or a 16 to 1. I've had teenagers come into my office profiled at 40 and 44 to 1. That is severe, severe inflammation. And by the way, it has nothing to do with the morphology of a body. One of them was a 14 or 15-year-old, and I think she was 90 pounds wet. So it has nothing to do with being heavy or being thin. You can be thin and inflamed, and your body can be larger and you're not inflamed. So that's not the telltale sign, as many people think, that they could just look at somebody overweight and say, you're insulin resistant. It just doesn't work that way. So, and thank you for the credit on the liquid omega. Yes, all my fight for kids, I'm like the voice for the children, is I needed to find a supplement that made sure that they got the omega-3s reversed in order to enhance the brain development. So this company worked very nicely with me and some of their biochemists, and we got it done. So I'm very proud of that.
A lot of things that the mothers wanted to hear about is how the gut affects the brain. Well, here you go. We're about to go into it. So the next fancy word, like methylation, is this big fancy word called neurotransmitters. But again, we're going to break it down. Neuro means nerves. You remember the cranial nerves that went to the brain, all the nerves in the body, are transmitting signals. Now the question is, where is the transmission of the nerves going? Well, it's going from the gut, and if you look to the right, neurotransmitters, and it's an arrow going towards the brain. Now, as you can see, where it starts with the gut and goes to the neurotransmitters, look at the pathway after that. Anxiety, mood, stress, brain. Now, the question is, what about the gut percentage goes to the brain? Well, if you look down there, the gut and the brain are chemically connected via neurotransmitters, where 90% of the neurotransmitters comes from the gut. 90% of the mood of your child comes from their gut. Well, let's look at some neurotransmitter mood behaviors. Adrenaline causes a fight or flight. That's what you guys were talking about earlier, fight or flight, as if there was a stressor in their life. They're going to be anxious. GABA will calm them down. Noradrenaline, to concentrate and focus. Acetylcholine is for learning. Dopamine for pleasure. Glutamate for memory. Serotonin, that's a big one. Remember, serotonin for mood, and endorphins for euphoria. So if you go to mood for the serotonin, and you go to 90%, is going to there, 90% of their serotonin from their gut to their brain affects their mood. Now, when there's kinesiology spots, we aren't even talking about applied kinesiology and clinical kinesiology, but there's kinesiology spots that go up to the brain that we can actually figure out in the office which neurotransmitter is not turned on. For example, if GABA is low, if you look here, if you put your finger near the nostril here and test the body, which is what we do in the office, and it goes weak, we know that the large intestines that is connected to GABA is low, which makes them not calm. So what can we do about it? That's great and all, but what can we do about it? In the office, we can enhance their calmness by giving them the GABA neurotransmitter based off what we tested near the nostril through giving them GABA supplementation. And the minute we raise up their GABA and it brings down their adrenaline through these neurotransmitter supplementation, and that signals the gut to the brain, all of a sudden this fired up, amped up child who is misbehaving, the teacher is getting mad at their parent, and the parent doesn't know what to do, well, there's a way to center and relax them. So that's what we do in the office. Last thing I want to mention, this is in the bottom right, you can go on this link when you have the moment. It's a connection between low tryptophan and autism that was published by PubMed on the National Institute of Health. Now the question is, what's tryptophan? Tryptophan makes serotonin. 90% of serotonin affects your mood. So the lower the tryptophan, the greater the issues with the autism, because tryptophan is the precursor to serotonin. And if there's nothing that makes the serotonin, well, what do you expect your child to act like if that's the case? Feed the gut properly with the right neurotransmitters, fill up their brain with fats, and methylate them. And now you can actually have a real opinion on how well your kid actually is behaving. Because if you're not giving them these resources to thrive, how can you expect them to not have behavioral conditions?
Thank you. That was wonderful. Let me just mention also that there are 4 of the neurotransmitters that we're presenting tonight, but there are 25 that we study on each of these children. So not going to do 25 tonight, but the entire study is not just based on the individual values, but the patterns as well. And it's very important to put objective and subjective clues together in order to properly create a path for that child's care. I'll also say that Serotonin deficiency is probably the number one thing that I find in the office causing most of the problems, and the cause of that is SADs, the standard American diet, sugar, ultra-processed foods, grains. These are all foods that will affect the gut adversely and lead to a gut-brain issue. The healthier your gut, the healthier the brain. It's a very clear, simple connection, and most people's guts are not healthy. So I think that needs to also be like a primary focus, not just trying to get somebody to process things in a more acceptable way, but to go to the cause. And diet is a huge player, as are the supplements. These supplements are actually corrective. These children do not stay on them for life. They take them for a period of time. We see measurable progress in an acceptable amount of time, and then we reset their program. And again, it's based on physical exam and muscle testing, as well as many other methods we use in the office to test. Nothing is painful. And then we match all of that up objectively from computers that tell us if we're right with our diagnosis and if the trend is correct. We're never really focused on an individual value. Everything in the office is based on trend. So we look at things over time. We just start with baseline and keep looking back at the improvements.
So we just went over many of the nutrition things. There's a lot more about nutrition, but we have a limited amount of time. But one thing, although I do have a master's in nutrition and I'm certified in applied kinesiology, at the end of the day, me, my father, and my grandfather all have a doctorate in chiropractic. And it's very common here in the communities, but a lot of people say, what can chiropractic adjustments do for my child? I don't understand the purpose of it. Well, we're gonna explain how we can actually regulate their nervous system through chiropractic adjustment care. Well, first it's important actually, the speakers were talking about a little bit earlier was about sympathetic and parasympathetic, that fight or flight or that calm. So if you look all the way to the right, what makes a person calm is you can see it goes all the way, those arrows go towards the brainstem, the brain on the top, and on the bottom of the spinal cord. All in the middle of the spine is all the sympathetic fight or flight. When a child is in a very aggressive behavior, that means near their brain, their brainstem, their parasympathetic calmness is locked down, it's not opened up, while their sympathetic mid part of their spine is very locked up and it's not regulated. So the chiropractic adjustment is able to influence it through an adjustment that can regulate the calmness, parasympathetic, and the sympathetic part of the spinal cord. Now, the question is, how? Why? How can you regulate parasympathetic and sympathetic calm and fight or flight with an adjustment? Is because, you remember those cranial nerves, the cranial nerves to the methylation? One of those cranial nerves, number 10 on the cranial nerves, we were speaking about it earlier with the polyvagal nerve, is the vagus nerve. The 10th cranial nerve, right, you see under the brain, is the vagus nerve. When you give a chiropractic adjustment to your child, you stimulate, look at the bottom left, chiropractic adjustments stimulates the vagus nerve. Now, after you stimulate the vagus nerve with a chiropractic adjustment, if you look to the bottom right, we open up the brainstem, parasympathetic calmness. Look where that person's hands are on the skull. We traction it to create an impulse and allow blood flow to go from the trigger of the vagus nerve up to the brainstem, which stimulates the parasympathetic of the calmness. Now this child, which is actually really cute with the newborn babies we work with, after we give the adjustment, this colicky baby actually naturally, innately falls asleep right in the hands, which is beautiful because they don't even know what's happening. There's so much in La La Land after. But it just shows you the impact that we can do. So we stimulate the vagal nerve, we open up the brainstem, and watch the parasympathetic and sympathetic system balance.
Beautiful. That literally happened 4 or 5 times in my office today before coming here. I'll just say on that one of the other presenters stressed no screens, that's a big violation. And I'm going to tell you that any light will stimulate, will suppress serotonin and create a serotonin deficiency. You need serotonin to increase toward the nighttime in order to get the child to rest properly. And if you don't rest properly, there's no way the next day is going to go well for any of us. So that's why bring the lights down in the house toward the evening. Don't let them play with the lit tablets and things like that, because all you're doing is worsening the situation. Actually, they need a quiet, darker place, which will enhance the serotonin production through the blood. And then you can see some different behavior in these children.
So what else can we do in the office with chiropractic care? The next thing is something called sutures. So we talked about the brain is being inflamed and all the reasons why the brain can be inflamed and how to deflame the brain. Well, one of the reasons why the brain is inflamed is because outside the brain, there's a skull that protects the brain. However, what if the skull is putting pressure on the brain 24/7? Now the question is, how does the skull put pressure on the brain? Well, the main reason is due to sutures. So if you think about it, everyone thinks your skull is this hard thing that doesn't move. The reality is that can't be further from the truth. The skull is very movable. How is it movable? Well, if you look at the top right, they do a beautiful job color coding it, where the skull is actually made up of a bunch of different pieces that are connected like puzzles. So you know how you have a bunch of puzzle pieces and they line up perfectly and you make a beautiful painting, a beautiful puzzle piece? That's how the skull works. So if you look to the right, there's a frontal bone, and then there's puzzle piece division to the parietal bone, to the temporal bone, to the sphenoid bone. So the skull is actually made of a bunch of little bones that are all together. So what I want you to see right here is I took this part of the skull and this part of the skull, and they line up nice and even, like this, right? And when they line up nice and even, they feel fine. Now it's hard with the microphone, but now, what if the puzzle pieces start to cramp up over each other like this? Now, if you can see here, there's less room underneath. Less room. When it's less room underneath, that's what's putting pressure on the brain. So the thing is, in the office, what we do is we take the sutures that are overlapping and we start to spread them out in the office because they're movable. And once you take it overlapping and spread them out nice and even, all of a sudden it takes the pressure off the brain from this to this. And the minute you take the pressure from the skull by opening up the sutures and giving the brain a moment to breathe in there, man, oh man, does the inflammation go down. And because of that, they wouldn't have as much strenuous behavioral conditions when something's not pushing on their brain because the sutures are overlapping each other for who knows how many months or years or since birth, which is why when you look at the bottom left, there is no better time to do cranial work and open up the sutures than when they're a baby. Started from the beginning, especially when the skull is a little bit softer, known as cartilage, like your nose or your earlobe. And as you get older, although the head gets harder, the sutures are always there and they're always adaptable and movable.
Yeah. So a lot of people say, why are the cranial bones out of place in the first place? Bill, the reason is that hopefully, well, most of them are natural deliveries. So the skull actually has to go cone-shaped. And then when it comes out of the mother, it expands. And it doesn't always expand into the perfect position. These joints are a little like shark teeth that fit together. And so they could be a little too apart, or they can get jammed, like my son was saying, and they actually like buckle, the way a piece of concrete might buckle from the tree, and then it's not going to be smooth. And whatever plate of the skull is misaligned or not in its best position, it usually affects the piece of brain just below it. And we know what each piece of brain connects to. For example, the back of the skull, oddly enough, controls everything in the front. It's for your vision. It's the furthest point from the back of the eye, so it's actually perfect. The frontal lobe that he was talking about behind the frontal bone, that's for your motor function, mostly. And so each piece of brain does different functions, and the point that's out would usually affect that function. So when the parent comes in and explains exactly what the child's having difficulty with, we can usually backtrack it to this as well.
So we started off with
One more note on that is that the babies that are C-sections usually don't have this issue. They usually have more hip issues.
Okay.
For obvious reasons.
So we went through nutrition, right? The methylated B vitamins, giving the fats for the brain, and the neurotransmitters from the gut to the brain. Then we did what is me and my father doing in the office as far as the chiropractic care with the vagus nerve and the sutures. And now the last part is there's an analogy I like to give patients where, you know, I can give you a new pair of shoes, I can give you new shoelaces, I can give you new orthotics, all this beautiful stuff. But if we go outside in the city right now and I took a pebble or 2 or 3 or 4 pebbles and I put in the shoe, I don't care how good that shoe is, it's gonna hurt every time you take a step. So we can give you the supplements, we can give you the fats, we can work on your sutures, we can adjust you or your kids. But if that child goes home and these toxins are in their life, now we're on a treadmill and we're kind of making a little headway, but not as much as we could. And the thing is, some of these toxins you might not even be aware of. So let's look at the top right. As you can see, that is a moist window, and it was probably cold outside, and right on the inside of that window, there's a blackness to it. That blackness is called mold. Now, mold creates spores in the air. This mold can develop behind your kitchen sink, behind the laundry detergent, near any window, near the heaters. It can happen anywhere. And if it's in your child's room and throughout the night, they're breathing in these spores, that's going to mess up their brain if they spend 1/3 of their life breathing this in. So if you need to hire someone to look at every corner of your house to see if there's mold anywhere, or you need to wipe down everything and you got to look at every corner of every piece of house, because if they're breathing it in and it's stimulating it, it's going to go straight from the nose to the brain, which is going to cause inflammation. Although you can't see inflammation from the outside, their mood is going to tell you their brain is inflamed. Another thing, now you're cooking dinner, right? And when you cook dinner, or you're deciding to wrap the dinner from leftovers, you're wrapping it up and cooking it with a heavy metal like aluminum foil. Now, if you do aluminum foil and you're cooking with it, where do you think the aluminum foil goes? Into the food. Now you're having heavy metals go into the food, they're breathing in mold during the night. Sounds like a bunch of pebbles to me. Let's keep going. My father already brought this up. When we look outside right now, you know, we're hypocrites, but if you look outside right now, it's nighttime. It's dark. And when the sun goes down, you're supposed to go to sleep. Now the brain and the human body is not so intuitive because a long time ago there used to not be lights, right? So when we have lights in the home that are nice and bright during the nighttime, it tells the brain that it's still daytime. So if you tell the brain it's still daytime when it's nighttime, now their rhythms of life are now off. And you're ruining their sleep, but most importantly, you're ruining their next day. because when it's dark and the sun goes down, that is a trigger that you should be lowering all the lights and get ready for sleep, not the other way around. Now, you cooked with the heavy metals of the aluminum foil, they're breathing in the mold, the lights are all on at night. Now, they're on their way to the school bus, and you don't trust them that they're gonna end up losing their stainless steel water bottle. So what do you give them? You give them a plastic water bottle. Well, I'm sorry, but every plastic has something called microplastics. And the microplastics of the plastic water bottle goes into the water. And when they drink the water, the microplastics go into their body, and that disrupts their hormones. And what are hormones? They're your neurotransmitters. Remember those neurotransmitters from the gut to the brain? So now they're onto the school bus drinking that water bottle because you didn't want them to lose the stainless steel, so you got microplastics going inside them, and the lights were on the night before, and they're breathing in the spores, and you cooked with aluminum foil, and now they don't have time to eat a nice, beautiful breakfast with those healthy fats that we were talking about, so you give them some pretzels or some crackers or some bread or whatnot, and guess what? Every slice of bread, and my father talked about the sugar, every slice of bread is worth a teaspoon of sugar. And it's not to even mention that the body can't even digest bread because of the gluten, because of the wheat germ agglutins, because of the zonulin, and all these other things. I'm just sticking that every little piece of, I don't care if it's camote, or these patients come in camote, they come in with spelt, they come in with whole grains and everything. Bread is bread is bread, sugar is sugar is sugar, and just because it's convenient, you are destroying their gut, and sugar causes inflammation every single time. Now, they have the plastic water bottle, they have the bread. Well, because they're too young for coffee, most of these mommies send their kids on the school bus with a juice box. Well, it turns out that juice has fructose. What is fructose? Fructose, let's break down the word. Fruit is fruit. Ose, anything that ends with the word ose, like glucose, means sugar, fruit sugar. Fruit sugar goes straight to the liver and damages it. Now, I want to scare you guys as mommies and daddies that fruit sugar is maybe the scariest thing that ever came known to man.
Can you say that again?
Fructose, juice, is the worst thing you can ever give your child.
Hear that.
Juice is the worst thing you can ever, maybe bread or juice, I don't know, pick your evils. Is it the worst thing? Yet, they go onto the school bus with the plastic water bottle, the juice, and the bread. Now, why is fructose so bad? Don't just take the Dr. Forster's words for it. Let's use common sense. Bottom right, fructose, right, fruit sugar. When someone has fructose, fruit sugar, like juice, excess fructose builds up into the intestines, you remember the gut. This fructose binds to tryptophan. You remember that PubMed article with tryptophan and autism? The fructose binds to tryptophan, preventing the body from absorbing it. This tryptophan reduces serotonin. You remember serotonin was the neurotransmitter for mood. 90% of your mood comes from your gut, which comes from serotonin. Serotonin comes from tryptophan. Low tryptophan is connected to autism. And when you drink juice, because it has fructose, it lowers tryptophan in the body. When tryptophan levels are low, the body can't produce serotonin. When the body can't produce serotonin, look at the last thing. It leads to depression. Low levels of serotonin can contribute to depression and other mood disorders. Isn't that why we're here today? Because your child has mood disorders? When they drink juice, it's causing their mood disorders. People with fructose, malabsorption, and depression may benefit from a diet that's low in fructose. May benefit, they're being kind, will benefit. So now the last part of it, God forbid your child gets a little hungry, you give them a snack, and it seems like, it's safe or whatever. Flip over the ingredients list, and half the things you're probably reading have either fruit or bread of some kind of grain of it, and that's a perfect example. So between the breathing of the mold, between the bright lights all during the day, and giving them the plastic from the plastic water bottles, and giving them that bread, and giving them that juice, and cooking with the aluminum foils or the plastic, and then you expect your child to behave appropriately? Give me a break. I wouldn't be able to behave appropriately. The reason why I don't do any of this and I eat my fats and get methylated and do the right neurotransmitters and get chiropractic care because I want to be the best doctor for my patient. And if you put me on a program like this, man, I'm going to be a terrible doctor. And these children cannot be great students to grow up to be great human beings that they rightfully deserve if you put them in a position to fail. And it's not your fault. You don't know, but now you do. So now you can make a difference. So here, we're giving it to you. Just do it. Do it.
Thank you. And your passion is amazing. These substances on the slide right now, the general study is called hormone disruption, and the importance of that, my son said, is some of these hormones become the neurotransmitters. Those are the ones that will go into the brain. They don't just stay in the body, and they will affect your mood, the way you think, the way you feel. The important thing I want to discuss about the water and the plastic particles is that you get 2,000 nanoparticles of plastic in you with every sip, not every bottle. That's substantial. That will affect your health. And the third thing I'd like to just inform you of is that the reason why fructose is so bad is it's a monosaccharide. And so when things get broken down as a single saccharide, a single sugar, it doesn't use insulin. It uses cortisol. Cortisol is a stress hormone. It's a first cousin to adrenaline, as was discussed earlier this evening. So if you're doing anything to raise cortisol levels, you're actually working against yourself. And if you're doing a lot of right things in life, but then you're coming home and doing these violations, I will literally tell you that it is like kicking water uphill. It is futile. You will be exhausted and get nowhere. It's important to put the whole program together as a three-legged stool. And if you pull one leg out, it's just not going to be stable.
Okay, so we went through nutrition, we went through supplementation, we went through chiropractic care, we went through toxins. They're all very important and no thing is more important than the other. But one of the things that hits home, I think, the most for everyone here, and the speakers did this so beautifully, is we label our children. And I get it, doctors will label their patients with a diagnosis. I understand that's the world we live in. However, when you tell a child their diagnosis and their identity in front of them, what you hear about yourself is what you end up believing. And that's scary. There's a beautiful book by Dr. Bruce Lipton called The Biology of Belief. And basically, what you believe is truly who you are. And the reason why I say that is your children, no matter how much on the spectrum they are, I guarantee you, they hear everything. They hear everything. Now, if you look at that bottom right, that is you and your husband talking and saying, what are we going to do with our child? We bring into craniosacral therapy and this therapy and that therapy, and they're still misbehaving in school, blah, 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 blah. Well, guess what? Whether you realize it or not, your children are hearing you guys bickering back and forth, and they feel terrible. They feel bad about themselves. And they feel like, wow, deep down inside, I am letting my parents down, whether they know how to express that or not. So whenever they are 500 miles near you, you only talk about them in the most amazing behavior in the world. It's not my child who has autism. It is just your child. It is just your child. It is not my autistic child or my ADHD child or my child who has depression. Don't even say it to me in the office. This is my beautiful child, and we're gonna boost up their happiness. They're gonna boost up their focus. It's not that my child is, having trouble talking in school, do something about it. No, I just want them to participate more. So when you show that love and they feel that, they start to believe it. And when you start to believe something, they walk around life thinking it. Whether they're actually true or not, whether they're actually an A student or not, if they feel like an A student, what's better than that? I'd rather my family feel like an A student, whether or not they are, than even if they are and they don't feel like it. Because what's the point in life if you don't feel like a rock star? And if they are the most vulnerable around you guys, and they have the most trust around you guys, and when you identify them and you lose faith in them and you get frustrated, they feel it and they live their life like that. So kick it into gear, figure out, scream in your car before you go into that house, because the minute you see them, you better look like that bottom left every single second of every single day. Okay?
Beautiful. Nothing to say on this slide except we're showing our kids love and support, and what more can we do as parents and grandparents? Thank you.
So I appreciate you guys. This is just gratitude and love, where me and my father can only see a certain amount of patients in a week. We're booked 2-3 months out. And the thing is you guys have to spread the word, because we can only do so much. So I want to thank you for putting this together and inviting us for this opportunity. The whole Shemesh Revolution staff for orchestrating this beautiful event in this beautiful venue and bringing everyone together. And you guys as parents, because I know deep down inside we all, at 10, 11 p.m., we'd all rather be home right now and not be here. Trust me. My father lives in Long Island, I live in Manhattan. We would like to be home right now. But we all love our family so much, and if we can do a little bit more good and get a little bit better, it's worth it. And that's why we're all here. So I want to congratulate and clap for you guys for taking time away from your family for being here today. And the last thing of gratitude and love is for the children. We're all here because we love our children, and our children love us. And at the end of the day, no matter how hard it gets and how much we feel like we're at a crossroads and we don't know what to do, I know deep down inside we're all super grateful for the child we have. So I would like to say we're speaking for the Dr. Forsters. Thank you.